Welcome. Thank you for taking the time to view my presentation, and I look forward to learning with you today. Today, I will be presenting you with information about dimethyltryptamine, which is more commonly known as DMT. Specifically, we will be discussing the neurobiology of DMT, biological and psychological effects of DMT use, and the social consequences associated with the use of DMT. What is dimethyltryptamine? DMT is a monoamine alkaloid produced endogenously by the pineal gland in the brain, and it shares structural similarities with the amino acid called tryptophan. DMT can be found in plants, fungi, and in very small amounts being produced organically in the brains of mammals. Richard Mansk was a Canadian chemist, and in 1931 was the first person in Western culture to synthesize DMT. Following Manska's footsteps was microbiologist Osvaldo Goncalves de Lima, who in 1946 made the breakthrough discovery that DMT existed organically in certain plant life. Finally, in 1956, Stephen Zara, a Hungarian chemist and psychiatrist, discovered the hallucinogenic effects of DMT when he extracted the drug from a plant and then administered it to himself via an intramuscular injection. So the neurobiology of dimethyltryptamine. There are multiple systems that are involved in the production and the transportation of DMT throughout the brain and the body, such as the central nervous system, the medulla, the amygdala, the frontal cortex, the frontoparietal and temporal lobes, spinal cord, and pineal gland. However, it can also be formed in the L-amino acid decarboxylases formation of TI and dimethylation. Based on what is known about how DMT is produced, stored, and released by mammals, we know that DMT can be found in higher concentrations within synaptic clefts and neuronal receptors. However, it metabolizes very quickly, with only trace amounts being present in urine that was used in drug screening, even when the drug is introduced to the system in a non-organic manner, like smoking it or snorting it or taking it in capsule form. Like, that part does not matter. So, biological benefits and risk. So, we know that the use of any drug comes with both biological and psychological risk and benefits, but this may be especially true when the drug is classified as a hallucinogenic. So, we will start off by discussing some of the biological risks that are associated with DMT use. So DMT causes both audio and visual hallucinations. And this drug works by causing a change in the serotonin levels that exist in the brain. This causes a distortion in how the brain processes visual and auditory stimuli. So individuals who abuse DMT, which is a serotonin agonist, are at a significantly higher risk of experiencing something called serotonin syndrome. So serotonin syndrome occurs when the brain is flooded with too much serotonin and is unable to properly process it, which can then result in symptoms such as confusion, aggression, decreased muscle coordination, elevated blood pressure, seizures, respiratory distress, and an increased risk of kidney, liver, heart, and brain damage. So now we will move on to the psychological benefits and risk. So with DMT, the psychological benefit that I would like to discuss with you today is how this drug can be leveraged to manufacture a near-death experience that can leave the consumer of the drug with long-lasting positive psychological benefits. And these long-lasting positive psychological benefits can actually improve quality of life and overall psychological well-being. So there has been research performed that provided evidence suggesting that this approach can be especially beneficial for individuals with terminal illness who experience death anxiety or distress related to the dying process. Since the brain of mammals produce higher quantities of DMT during the active dying process, having a medically induced and controlled experience with that can help to alleviate fears and anxiety while improving the remaining quality of life for the individual. So next we have social consequences related to the use and abuse of DMT. So one of the primary social consequences associated with the use of DMT is that it is now widely available, although illegally, for recreational use where it is used in an unsafe manner that can result in injury or death. So research has shown that while tryptamine use and abuse is more rare than other more well-known drugs, it did have a 273% increase between the years of 2007 and 2018. And the use and abuse of DMT is far more prevalent among populations who use other drugs like ecstasy or other psychedelic drugs recreationally. So, while DMT is frequently promoted as a healing drug that can help with psychological well-being, anxiety, depression, transformative psychopharmacology, and even alcoholism, we must be very clear with those who may attempt to use the drug recreationally that DMT is not a cure, but should be used in combination with a therapeutic approach, such as transpersonal therapy that occurs with a professional. Thank you.